Well, thank you for suggesting that this is a genius idea. We never really realized that this was a genius idea, but at some point we realized that this was probably a good idea. And I think one of our surprises was the fact that in the beginning we expected a lot of resistance from medical doctors, from medical professionals. And it turns out that in fact doctors and nurses and other professionals were among our strongest and still are among our strongest supporters. So we thought, wow, even doctors and nurses like this concept. So it must be really a brilliant one.
I think all the meetings of the Patient Innovation Advisory Boards are really impressive, really great. So it's difficult to pick just one. I think we learn a lot in each one, and it's really impressive how much and how is the engagement and the inputs of our advisory board. They not only help in choose the best solutions, but also discussing the strategy that we will take in next years. So all these meetings are really impressive, really good, and very important for the present and the future of patient innovation.
I think the most important advisory board meetings were the early ones. For instance, the first meeting, even before the association was created back in 2014, was when we decided that we wanted to move forward and create patient innovation. So obviously this was very important because we were getting the endorsement of people like Sir Richard Roberts, a Nobel laureate in medicine, Aaron Ciechanover, another Nobel laureate, Eric Van Ippel, Bob Langer, Lee Fleming, Catherine Strandberg, or Kjeld Larsen, who joined the advisory board at a later stage. There are hundreds of solutions that I really like, that I think have had a big impact on the life of many. But there are probably two that I've talked more about, and those are the early ones. Probably there are two, I would say, Taylor Goldsworthy aortic support, as well as the frequencer by Louis Plant, are probably the two initial solutions that we found. And those were actually the ones that inspired us to go ahead and create the platform. So for sure, those are among my two favorites and those that I keep talking about for obvious reasons.
For me, it's difficult to choose just one. I like many solutions. Maybe I like a lot Michael Series solution, the solution, the iostome, where the bag has a sensor that detects when the bag for the content of the ball is full, because I think it's a simple but innovative solution. And it's really important for the patients. So I like this solution. But of course there are lots of solutions that are really important, and that are easy to demonstrate, that the needs of the patient sometimes are not the same that the solutions the companies develop.
What I value the most about patient innovation is the possibility of working with patients and other users, for instance, informal caregivers, that typically are not the usual suspects when it comes to innovation. So the possibility of identifying these unusual innovators, helping them to bring forward the solutions that they develop all by themselves, knowing that these solutions, if shared with many, can actually have a real impact. And we know that we are having a real impact on the lives of many people around the globe. So, of course, that's what I value the most about our project.
I learned a lot, and I'm always learning with patient innovation. I'm a physician by training, I'm a clinician, I have my patients, so patient innovation is a great complement for me as a physician, because in a way I listen more the solutions that the patients developed and their needs, and at the same time patients can be really a partner, and I know this by Patient Innovation Project that they can be a partner in the developing of new solutions and new innovations in this field of care and medicine.
Well, it's different in the sense that we now increasingly focus on the development of the solutions, on helping the innovators to actually do something about it, further develop what they have, eventually, commercializing the solution, eventually creating a firm. So we do bootcamps, we do a number of initiatives that we didn't do in the beginning. So yes, the concept has evolved.
I think this is priceless. So there is no price for this. The impact is really high, and what we want is develop more and more this project and reach more and more people.
Well, I don't know, but there are lots of technologies that kill, that destroy, Terminators, guns, etc. I think I would like to have a technology that could heal people, that could fix problems. Maybe some sort of robot that could touch a patient and heal him or her. That would be really nice. I would like to have a technology that would basically make patient innovation totally useless. That would be my dream. So the big focus of our project in the near future is going to be on impact. We really want to focus on helping patients and informal caregivers to actually bring forward the solutions that they developed, help them to either freely share the solution, help them matching them with the existing firms that can eventually bring the solution to market, or eventually help them becoming successful entrepreneurs. Depending on what they want to do, we want to have an asset, a solution, a service that can help them.